day. Your girl is struggling this morning. It's 7:43. I have to be at the hospital at 8 to check in. I think my appointment is at 8:30. I can't remember, to be honest. I have 8 on my calendar, and then my phone says something about 8:30. I don't know. I really started to cancel the appointment because it's 43 degrees in Florida. My body did not want to move this morning. I'm in so much pain. And I'm like, okay, I got 2 more days so I can get my infusion. I'm just really, it's just having a hard time. I got really down and out last night. I did have a video go live, discussing the issues with my scalp. It's not about me losing my hair. Of course no one wants to, but it is what it is. I'm just like, the fear of having one more diagnosis added to what you already have. That's my, I know we're not supposed to fear because everything's in God's hands, but it's a lot. So I will be calling my doctor shortly, to find out what I need to do. And, I don't know at this point. I don't know. I've tried to kind of research it, and some say like you could do like certain like steroids to be on, or steroid creams, and then it said Plaquenil, which I can't take. So I don't really know a whole lot of treatment when it comes to it, because every time you pull it up, it's just like, okay, don't be confused. It's not, not to be confused with systemic lupus, because of that affecting your organs. And, they're saying like the skin is not as, life-threatening, but you could have infections. And I'm thinking to myself, well, for us getting infections, that means that could be life-threatening. So I just got to do more research. Like, I literally sit in the sitting room. I had dinner, and I was just sitting looking at the wall for probably 30 minutes, just give me strength, God, to endure and deal with something else. And I know at the back end, it's a testimony for someone else. And my channel, I have people that email me. It's reaching other people for awareness and reaching America. But sometimes it's just it's a lot. So let me pay attention, because traffic is, I guess, pretty bad because it's a school day. And make sure everybody got their taxes done. So my husband tried to do our taxes, I think it was Friday or something, and he needed a number from, I don't know, from our old taxes. It wouldn't even take the return. It kept kicking it back. So I was like, well, I guess you need to just go where you can print it, but you're gonna have to get ink to print it. So I don't know. I'm like, geez, we just got this new printer, and I had to print out packets for the track club, and it's already empty for the black ink. Yeah, so that's kind of frustrating. But let me focus on this traffic, and I'll come back after my CT scan. And they're doing the CT of the thoracic, a high resolution CT scan. I didn't grab anything to eat because I couldn't remember. Something's telling me they said not to eat something. I don't know, but I can't remember, to be honest. So all right, guys, so I'm done with the CT scan. When I tell you that it's 8:38, so it was good timing, but the tech really ticked me off. she was well, she, you know, I had to go take my bra off and stuff, anything that had metal, because they were doing the scan on my chest and lungs. So she was, you know, kind of seemed like she was aggravated that I had to take my bra off. But anyway, so she was like, okay, I need for you to lay on the table, you know, with your feet going in the machine. And I said, okay, because I've had CT scans before. So I looked down on the sheet. Sorry if it's a glare. And there was something that looked like, you know, dried blood or whatever. So I said, hey, I said, can I have a new sheet? Because is that blood? She snatched it up. She said, it's a clean sheet. Apparently it's not. If I see something on the sheet, you lay your big behind on the doggone table with something that look like blood. I'm not. And then when I got ready to get up, she was like, before she, you know, I could even get all the way off the table, she's snatching the other sheet off. I'm like, you know what? Try me, because I will be reporting your behind, because I know your name. You feel me? Like, why would you have, you know, most people make jokes about, you know, you never know what you're going to get from you know, the house keepers or the laundry company. But I was taught, like, I did CNA stuff like maybe 3 months out of my medical career. But when I was working in ICU, that was one of the things that, like, the person that was training me would say, look at the sheets, because, you know, a lot of times when the housekeepers are getting the sheets off, they just bung them up and then they go to the laundry service, and they're not going through to make sure stuff is out, like tape and just different random stuff. So her thing was always like, would you let your mom or grandmother be on this sheet if it looked crazy? Because some people will just put the torn sheets, all kinds of stuff, and they have bins for those. Like, hey, if it's really soiled, like, it's a discard bin, and you know you're not supposed to reuse it again. But girl, bye Felicia, because that just really, she ticked me off this morning. I'm like, I'm not finna lay on something that looks like blood. I don't care if it's clean blood or not. It's blood, or it's betadine. I don't know. And how do I know that you actually changed the sheet before I came in here? Child, please. So I'm going to get me something really quick to eat, because I need to go to Dollar Tree. So I just had to come in and let y'all know that I'm done and that I was ticked off. So when I get to the house, trust and believe, Miss Ashley was her name, and Miss Ashley will be getting a notice. When you're putting something out for a patient, you need to thoroughly check the area before you tell a patient to lay down on something. And I have an autoimmune disease, and I ain't trying to catch nothing from nobody else. Like, I already got enough crap back to sleep. The housekeepers should be at the house today. And well, at today, they're supposed to get there at 9. It's 9:30. So hopefully they will be almost done, because I'm tired and I'm ready to just lay down. We're giving, like, there's an issue because she keeps changing her prices, and so she told my husband this time around she'll give us the 2-week rate, which is $75, but the last time she charged us $95, but we have been paying $85 because she comes once a month. And they have not been doing a very good job. My husband had to get onto them a couple times the last month, you know, about everything that they were doing and, you know, not doing. And the owner, she helps clean, but she has 2 workers that comes with her. And she's like, oh, I ticked them off before they got here, and they're mad at me. My husband's like, what does that got to do with them doing their job? Like, I don't care that they ticked you off. That's not my problem. Or, you know, they're mad at you. So there was things that they did not do. So my husband's like, I'm gonna give him one more chance, because the owner, when she cleans, you know, the area where she cleans, it's like spotless, but the workers is always something they gotta go back behind and you know, do. And I told my husband, I was like, hey, move the telescope and all that stuff from by the TV, you know, so they can get over there. He was like, well, they can move it. I was like, yeah, like they knocked over my vase. Anyways, so we're gonna give them a try to see, like, hey, hopefully they're in a better mood. And, you know, if I can see consistently that you're doing what you're supposed to do, we don't mind giving tips or anything like that. But every single time, you know, that we've dealt with them, I think we've had them for like 5 months. I can't even remember. 5 or 6. That we'll see stuff after they leave. So my husband's like, nope, I'm going room to room to make sure everything is, you know, done the way that it's supposed to be done. And it's just hard when you're trying to find, you know, because like I said, my husband used to do like Mary Maids or Molly Maids, whatever they're called, when he was like on his own before me and stuff. But I'm not used to having a housekeeper and all of that jazz. So if it doesn't work, we're gonna be back on Home Advisor, trying to find somebody else to come out, because it's just like almost like they're getting comfortable or something. I don't know. But we work hard for our money, and we just not gonna waste it on people that's gonna just be mediocre. So I'm almost home, so I'll come back a little later. Hey guys, so cleaning people just left. I did not reschedule with them because once again, I'm checking the rooms. She had some other new person, and homegirl looks like she was strung out on some type of drug, like meth. And I told my husband, I said, I didn't reschedule. I'm not feeling it. And then what topped it off is I'm sitting in my bedroom because they needed to get in the office to clean. So I'm sitting there. The other chick knows that I'm in there. And she tells the girl, she said, hey, do we get paid tomorrow? And the girl said, yeah, we do. Sometimes she'll pay us today, just depending. And she was like, well, yeah, I'm really hurting right now. I need money. I don't have gas. So I'm thinking like, okay, that's normal conversation. She said, well, I gotta go put money on, I guess, her husband's boyfriend. Oh, no, ma'am. So I told my husband, if we continue with them, it needs to be the owner and the one girl that we've been getting all the time, or nobody, or we just can't deal with you because you got these people that look like they strung out because you trying to get no, that's bad business. I'm 38 hot, y'all. You just don't understand. And the owner was like, hey, how are you? Because I wasn't here when they got here. And I said, I'm fine. And she was like, I'm through. Because stuff like that, you trust people to come to your home, even though we're home. But we have, like, my husband will leave a bunch of change and sometimes cash, on the dresser. Just stuff that I don't want around certain people. And you shouldn't have to, like, not feel comfortable in your home to have someone and you got to watch over your shoulder. Are they going to take something? Or let me count all of my jewelry to make sure all my jewelry's here. You know what I'm saying? Like, it's too much. So I'm going to call the owner because I had to really calm down and just express our concerns in the conversation. Because that was just so unprofessional. And the owner was even telling the other girl, like, can you please show that child how to dump the dump the vacuum the correct way, because apparently I guess she had dirt all over the place. So now I got to go outside, and it's like, where did she put dirt at? You know what I'm saying? Like, sweet baby Jesus, I ain't got time for this. I just have to clean my own doggone house. Like, so what I'm about to do is finish a couple of things for track for a deposit. And trying to look to make sure she didn't leave a trail of dirt somewhere. So I'm going to do a deposit, and then I'm going to lay it down because I'm tired. I'm aggravated. I get really cranky, you know, a couple days before my treatment because I just don't feel good. And no matter what I do, I can't seem to get relief. Yeah. So I'll come back later, guys. Hey guys, so I've done everything that I needed to do for track. I just took a migraine pill, and a muscle relaxer because my head is killing me. First I thought I was like, well, maybe I need to eat. And so I had a sandwich for lunch, a ham sandwich on honey wheat, and it has not let up. And that's probably been like 40 minutes ago. But my head was already hurting earlier when I got home, a little bit before I got here. So the hubby just left to go pick up Easter from school because she has a new schedule. So the bus picks her up in the morning, but we have to get her because we're not allowing her to go all day. She only goes a half a day. And my husband was like, you know, you don't need to stress yourself out about, you know, the situation with my head. And I was like, I'm not even worried about that. I said, I'm just hurting really bad, and I get really irritable, and I don't like being that way. I did talk to my rheumatologist, and all they said was she could call me in some more scalp oil, or if that's not working, then I need to just go to the dermatologist. So I just said, fine, send me to the dermatologist. Like, I don't wash my hair every day. So you have to, like, when you're using that, you have to wash it out. So my husband's like, well, what if the dermatologist says you have to use it every day? And I was like, well, if they say I have to, then I guess that's what I'll do. But that's a lot of work. Because, you know, I can barely, like, when I'm trying to put my hair in a ponytail, to keep my arms above my head for an extended period of time. Which, don't get me wrong, my husband will wash my hair and dry it. And I can show him how to flat iron, but it's just a lot of work. So I just want someone to know what's going on. And if it's discoid, you know, I know that's skin part of lupus, but I just felt like she should have been able to handle that. So comment, like I said, below if you suffer from it. And does your rheumatologist treat it for you, or do they send you to a dermatologist separately? So we'll see what they say or whatever. But I did call. So I'm just going to take a nap. Trying to unwind. I just faxed my lab order because I have 2 lab orders that I need to get drawn when I go Wednesday for my Benlysta. Since I have a Metaport, that's how I have to get blood draws. Because my veins are just non-existent. There's one lady that can get one like in like my thumb area, but it hurts like the dickens. So I just normally take my lab orders whenever I have to go to my infusion. So they draw it beforehand. So yeah, so let me rest, guys, and hope I feel better. Hope everyone's having a good Monday and had an awesome weekend. Comment below. Let me know what you did over the weekend. I would love to know. Talk to you later.